Hello, my name is Gabby Taylor. I actually have worked in a couple of settings so far that have individuals with mental health diagnoses. My most recent job, I worked as a case manager for the Division of Social Services, providing employment and training services to individuals dealing with multiple barriers such as loss of employment, chronic homelessness, lack of transportation, criminal records, lack of education completion, mental health diagnoses, extreme trauma, and substance abuse issues and domestic violence as well. Um, I've also worked in the inpatient mental health setting as a mental health technician. As far as the scope of my experience, participating in a treatment team to make DSM-5 diagnoses, that is not something that I've ever done. As a mental health technician, I did work in a facility where a treatment team was conducted, and the input from the mental health technicians was essential in making decisions as far as one, how to diagnose a patient, and two, how to undergo treatment for them. So they really would look to us as far as getting a report about different patterns of behavior, different things that we observe within the patients in order to make their decisions, especially in cases of deciding if a patient was ready for discharge. We then would in turn work with the practitioners and the clinicians to administer whatever was contained in those treatment plans with the patients, especially during group therapy sessions that we would hold with them as well. I also was on some case conferences as well. As a case manager, that was one of the things that we did with our clinical director to discuss our cases and a lot of the behaviors we would see as well. So I look forward to getting to know all of you in this class and just learning as much as I can to prepare myself for the field. Thanks.